Hi, I'm Sara Horst, a gastroenterologist at Vanderbilt University Medical Center who specializes in the care of patients with inflammatory bowel disease. And I was asked to talk today about wellness in IBD. And this is a pretty big topic, but what I really wanted to focus on is mental health. So we are learning that mental health in chronic disease is extremely important to start thinking about more, talking about more, and making sure that patients understand the impact. So in particular, in patients with inflammatory bowel disease, increasingly population-based studies have shown that patients with inflammatory bowel disease are twice as likely to experience depression or anxiety in their lifetime than someone who does not have inflammatory bowel disease. That's a lot. And we understand increasingly the impact that chronic disease can have on patients' lives, their quality of life, their work productivity, as well as mental health. So I think it's important for patients to understand this and start thinking about it because it also can affect patients' disease. So studies have shown that patients with IBD who have depression and anxiety are more likely to be hospitalized, have surgery, more likely to have disease flares, and more likely to be medication non-adherent. So mental health will affect physical health and chronic disease. So I think number one, helping patients understand that this is an important aspect to think about and focus on is key. Recognizing it, understanding that getting help for mental health is part of your disease experience. So a number of studies have shown that medications can be helpful that would treat depression. So that's number one to think about, and anxiety. Medications can be helpful, but also, and I think increasingly, we're understanding that psychological therapies can be extremely helpful. So there are studies that show that things like cognitive behavioral therapy can help patients improve quality of life, improve work productivity, decrease fatigue, and really by therapy that their lives can be changed. Other therapies that have been evaluated include acceptance commitment therapy, resilience training, even hypnosis has been shown to be helpful. And other things that could help with mental and physical health, like yoga, meditation, these kind of things have all been shown to be beneficial. So I think number one is just recognizing this is important, and then understanding that everybody's experience with mental health will be different. So it really needs to be tailored to the patient. And also understand that a lot of what we're talking about is behavior change, and behavior change for humans is very difficult. So it's not something that's going to happen overnight. And I think for my patients, I often talk about, you need to really think about this, start making it a priority, and then start small goals to help you get towards better mental health, however that's going to look for you. So I just hope when you think about inflammatory bowel disease and your experience in your life, that you remember that mental health and improving that and focusing on it is very important for your physical health as well. Thank you.